the $800 million healthcare scandal Ottawa doesn't want you asking about. Welcome to Wake Up Canada News. I'm Brad Wilder. This next article was researched and written by one of our Wake Up Canada News contributing reporters. Let's get something straight. Canadians aren't imagining the chaos. They aren't imagining the endless lineups in hospitals, the shortages, the strain, the collapsing infrastructure. And even while our own citizens are being told to wait, be patient, and try again next month, the federal government has quietly ballooned a program that most Canadians don't even know exists. And now it's exploded into an $800 million monster, ripe with controversy, contradictions, and unanswered questions. Welcome to the interim federal health program, the program that under Justin Trudeau's watch has morphed into an open checkbook health plan for, asylum claimants, including people whose claims were rejected and should no longer be covered at all. And now, the Conservatives, they're forcing the issue so hard that even Auditor General and parliamentary budget officers are being called and pulled into the mess. That only happens when something stinks badly enough that Ottawa's usual spin no longer cuts it. So how did we get here? While Canadians sit on wait lists for MRIs, cancer treatment surgeries, even mental health counseling, dental work, you name it, the federal government has been pouring hundreds of millions into a program that covers far more for non-citizens than many provinces cover for their own taxpayers. And it's not just basic care, it's not just emergencies, but supplements, prescriptions, counseling, dental, vision, assistive devices, mobility support, and more, quietly expanded and quietly funded without ever asking the people who actually pay for it. Then the numbers, they started exploding. A program that once hovered around a few tens of millions per year suddenly shot toward the $1 billion mark. Why? Because Canada's asylum system has been overwhelmed, abused, and mismanaged beyond recognition. And instead of fixing it, the government has been throwing money at it, hoping no one would notice. The bombshell? Coverage even after claims are rejected. This is the part that Canadians find most shocking. Under this government, the program has been covering supplementary health care for claimants even after their asylum applications are denied. Rejected claim? Still covered, still eligible, still accessing benefits many Canadians can't get. Meanwhile, seniors ration pills, families crowd emergency rooms, people go 6 months without a family doctor. That's not compassion, that's incompetence, and it's exploitation of the people who actually fund this country. Why are watchdogs being called in? Because when almost $1 billion of taxpayer money is being spent on a program that is ballooning out of control with no cap, no clear oversight, no transparent costs breakdown, and no honest explanation from the government, someone has to step in. The Auditor General is being dragged in because the numbers don't make sense. The parliamentary budget officer is being pulled in because no one can get a straight answer about where the money is going, who's being covered, and why this program keeps growing at a rate that defies logic. When watchdogs get involved, it usually means one thing. There are serious questions the government has failed to answer or tried to dodge. The real question, why was this hidden? This government has never once stood in front of Canadians and said, "We're spending nearly $1 billion of yours per year giving premium health benefits to asylum claimants, including those whose claims have already been refused." Why not? Because they know Canadians wouldn't accept it. They know Canadians are already furious about the state of their own healthcare system. They know the provinces are drowning. They know hospitals are collapsing under pressure. They know Canadians are sick of being told to sacrifice more while federal government spends like there are no consequences. So they hid it. They buried it. It's in estimates, shifted numbers around, and they hoped no one would notice as the program ballooned year after year. Now that the lid's blowing off, and Canadians, you better start getting furious. This isn't about compassion. This isn't about refugees fleeing danger. Canada's always taken care of those in true need. This is about gross mismanagement, skyrocketing costs, and a government that has lost control of its own systems and is now scrambling to cover its tracks. Canadians have every right to demand answers. Where did the money go? How many people were covered after their claims were denied? Why did costs explode? Who approved the expansions? And why were Canadians never told? Because if this is how nearly $1 billion is being handled in just one program, imagine what else is happening behind closed doors. This investigation cannot be just brushed aside. It can't be spun away. It can't be minimized. Too much money, too much secrecy, too many unanswered questions. The truth is finally coming out, and the government won't be able to hide behind talking points anymore. Thanks for watching Wake Up Canada News. Please like, share, and follow us on any of your favorite socials, including Facebook, YouTube, Rumble, BitChute, and our website at wakeupcanadanews.com. Till next time, hey, remember, you're the voice. It's really time to make it count. I'm Brad Wilder. I'll see you soon.